Hello, all. My name is Brianna Nieberge, and I am a senior biology major here at Millikan University. I just wanted to thank you for joining me today to listen to my presentation on the low health literacy and limited English proficiency barriers among Asian Americans receiving healthcare in the United States. For a little bit of background, health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make necessary health decisions. As stated by that definition, health literacy can go beyond reading capabilities. It can also include the ability to adequately comprehend medical information. So, this could include instructions, prescriptions, and making informed decisions in their healthcare plan. Health literacy gives the patient the ability to understand and apply medical instructions in order to promote their overall health. So, therefore, it could serve as a critical determinant of immigrant health. Asian Americans were the fastest growing racial ethnic group in the United States from 2000 to 2010. In 2014, there were 20 million Asian Americans that populated the US, making up 6.2% of the total population. 48% of that 20 million Asian Americans were determined to have limited English proficiency. This is a term that's defined as speaking or understanding English less than very well. Limited English proficiency is associated with poor health in Asian Americans, and it also serves as a co-occurring barrier along with this low health literacy in their overall healthcare. So given this information, I propose that improving patient-physician communication among Asian American immigrants will improve their overall health and quality of their healthcare. These barriers of low health literacy and limited English proficiency, they both require clinical intervention because together they result in some health differences among those that struggle with these barriers and those that do not struggle with these barriers. So, intervention is seen in a wide variety of ways within the United States healthcare regarding low health literacy and limited English proficiency. This first model I have here is called the chronic care model, and it's directed towards the relationship and communication between the physician and the patient in a more long-term healthcare setting. So improvements in the supportive self-management, decision support, clinical information systems, and the integration of community resources into healthcare systems will help create more productive interactions between the patient and the physician. So this model suggests that interactive patients result from a prepared proactive healthcare team. It also suggests that the interaction of Asian Americans with their physician can also be determined by social factors, as well as even the quality of the healthcare system in general. Some of these social or community factors include the provision of resources and even maintaining adequate self management. The organization of healthcare, the delivery of the diagnosis and instructions, and the decision support, all of these things fall into the quality of the healthcare system, as opposed to those social and community factors. So the next model that I have listed here, it's called the cultural competency model. And this addresses acute as well as long-term patient care. So this model suggests that the physician must first have a desire to engage with and understand their patient. It then shows that critical awareness, organizational support, and also skill development, all of these things work together to improve this cultural competency. So critical awareness, this is a cognitive factor, and it refers to the appreciation and understanding of different cultures and even the acknowledgement of one's own acculturation biases. The skills development factor, this assesses the degree to which one possesses the necessary abilities to adjust their professional practice in order to meet the needs of these Asian American populations. The organizational support, this assesses the institutional value placed on the promotion of other cultures, and it also highlights the importance of becoming culturally competent as a whole. So following this model, they suggest that having translators available as well as a culturally diverse staff could potentially improve these patient-physician relations. Another suggestion coming out of this model is the use of lay healthcare workers or community healthcare workers who share in the same cultural and language background as their targeted patient population. And this helps deliver health messages or information in an adequate way. So, for clinicians, the message is clear. Recognizing and addressing the healthcare communication barriers of these patients is essential. Clinicians, healthcare educators, and advocates should fully engage in with Asian Americans in partnership in order to develop and apply these culturally appropriate programs that address verbal and even written communication needs in healthcare settings. So, health literacy and limited English proficiency are both major issues contributing to the overall low health that is reported by Asian Americans. So, addressing this issue in terms of patient physician communication is essential in improving their overall quality of life when it comes to their healthcare that they are receiving. So, improving this communication will promote decision support, self management, and overall cultural competence within the United States healthcare system. So, my call for action is to integrate these models of cultural competent care into the American healthcare system in order to aid in the quality of care given to Asian Americans suffering from low health literacy or limited English proficiency, for they are a growing population within our nation. So to end this presentation, I just want to thank Dr. Delaney for all of her help on this research. And I also wanted to thank all of you for being here today to listen to my presentation on these barriers among Asian Americans receiving healthcare in the United States.